This patient had a follow-up brain MRI following the SRS treatment. And the rationale for doing that was to make sure that his brain mets were controlled and that there were no new findings. In this case, there were no new findings, so I would consider this patient safely treated, and the use of bevacizumab, I would say, would be safe in this gentleman from a CNS point of view. The next decision would be what's going on in his chest. He had a follow-up CT scan, and not surprisingly, his disease was a little bit worse, both in the primary as well as the mediastinal lymph nodes, and he did have a few new nodules in the same lobe as the primary lesion, which is not unusual. And sometimes we see as the brain is getting treated that since the chest hasn't been treated yet, it's at risk of progressing. But this patient had pretty minimal disease to start with, so I wouldn't consider this progression without treatment to be significant. As I said before, I think his options are either carboplatin with either pemetrexed or carboplatin with paclitaxel. The FDA-approved regimen actually with bevacizumab is in combination with carboplatin and paclitaxel, and that patient was treated with that regimen, which I completely agree with. I think it is a Category 1 NCCN recommended regimen. It is based on phase 3 data. We know that there's about a 35% response rate from the ECOG 4599 data. We know that it's significantly improved PFS as well as overall survival in 4599. So I think that I'm completely comfortable with his treatment at this time. In general, what I do is reassess patients typically after 4 cycles. I find that with a regimen like carboplatin and paclitaxel, that most patients tolerate 4 cycles relatively well without undue cumulative toxicity. But going beyond 4 cycles, patients start to get into some trouble with cumulative anemia, neuropathy, fatigue, those sorts of things. We have a number of trials done a decade or more ago that looked at either 3 or 4 cycles of platinum-based therapy versus 6 or more. There was no convincing evidence that 6 or more did better from an overall survival point of view or response point of view, maybe a little bit of benefit in PFS. So I typically stop at 4 cycles, but again, bevacizumab is a drug that we use until disease progression. I would continue bevacizumab as a single agent, as maintenance therapy. We refer to it as continuation maintenance therapy. And certainly my experience has been, that patients will get several doses, and occasionally some patients will get a couple years of bevacizumab maintenance benefit. There's a great deal of variability, and we know from the original ECOG 4599 trial that there were 2- and 3-year survivors remaining on bevacizumab. So there is a minority of patients that seem to get some long-term benefit from this agent.